10 centimeters like one area, you inject at least 18 per 18. So practically the double of the area. So let's say you want for these 4 vials, you can do it almost with 2 vials with a new one, you know. So it's better for doctor-like quantity, of even for the money that you spend. Okay. Okay. Can I have the alcohol?
You need to treat the fibrosis first.
No, the fibrosis, it's a part of the fat, it's fibrotic. So she will lose fat, but less of the normal that she will lose, and the retraction of the skin will not be so good like if she didn't have the stretch marks. Okay? Because fibrosis is even under the stretch marks. Okay? So let's say that you get inside from here, you see from till where arrives the needle. Okay? You grab always the fat, you get inside, okay, and you arrive in the part that you have to arrive. Okay? Then you go back, and every time that you get back, you have to inject around 0.3. This is a fun technique. When you inject, you must you have to take care to not touch the needle. If the needle you touch it and you feel it with the finger, yes, and this is the problem. Okay, so you go and you inject, and you inject. Don't affirm, my dear. Okay. So now I'm doing the upper belly, and let's say meanwhile you inject, and this is the part of the fat which is like a mountain. Now we are injecting always the lower part, okay? So let's say that I want to inject more to have more result, the middle of the fat in the upper part. So I make a tunneling here, and I inject even the upper part very fast, and finished, okay? This because the fat, you have to understand that have 3 dimensions. It's not flat. So when you grab it, first you will go lower, and then after you will do even the upper parts. Okay? Okay, that's it. The next... after all these years that I do this work, anyhow, this technique is very easy. When for me it was extremely easy because I was doing liposuction. So it's exactly the same like Klein solution. So it's nothing. Okay, but you have to take care. A lot of doctors. Now, another thing that must take in consideration is that a lot of the doctors, let's say, they think that if they have get inside from here, they must be symmetrical from there. No. The important thing is to inject the fat, not from where you get inside. So if I'm right-hander, and for me it's better to stay from here, or I have a clinic and I have a wall here, I have seen persons take them out from here and let them die and that. No, it's no reason, okay? I mean, you grab the fat and you just get from this part again, or you can get from the other, but the important is to think the area that you infiltrate, not from where you get inside to infiltrate, okay? So I can get, let's say, from here, I can go deep first, I grab the area and I go deep, and every time that I get back, I inject. I can inject around 0.3 every time. So if I have 8 ml, I have to do around 24 passes, okay? Now, listen. Sometimes by mistake can happen that the needle can get out of the skin. What happens? Nothing, because we are not injecting. So the needle comes out. She cannot understand because it's sharp. With the other one, with the cannula, they understand because it has resistance, cannot happen. And, you know, now you're like the mouses, you know, that they stay and they use them to doctors to learn. So we do a little bit. And after we inject the upper part, the superficial part of the fat to have a retraction. Okay, finished. So practical, you okay? What do you feel? Burning a little bit?
Yeah.
Okay, this is normal. Okay, so practically we have used 2 vials for the upper part, and we have divided a little bit of material in the upper part of the fat, because as we said, the fat is, this is the fat, okay? So we have to go lower and upper, yes?
You also inject 0.3 each time
Around.
In the upper part? Or
Yes,
the
everything.
same?
But you can even inject less. For example, I will show you something now. Taking the clinic into way to work with. Take out the thesis. For example, let's say that you have, you are injected and you have an area which is coming up, or you have a small lipoma. So what do you have to do? You have to inject only the lipoma or the small area. So let's say now, sorry, don't worry. Now I have to inject the lower part, which is less, okay? So let's say that I get inside from here, and I inject this area, okay? As you see, I'm injecting, okay? Now let's say that here is the area that has the most fat. I can even get out and get at 90 and inject the area to have better result. I mean, if you handle the needle, you can inject wherever you want. So I do a concentration in this part, then I can do a concentration of more material in the upper part, staying always and changing depth. And remember, there are doctors that, and now I go straight, and I go in all the area that I have injected before, okay? And I'm injecting the whole area. Now remember, what are, let's say, the problems that you can have? I will not inject more because it's enough, this 3 for you, okay? Because the lower was less. What are, let's say, the problems that you can have with the needle, like complication of injection, okay? The first and the biggest problem of all doctors is to hit their hands. This is the biggest problem, okay? Because you pull your hand like that, start injecting, and then the needle goes up, and you just traumatize your hand, okay? The first is this. For the patient, nothing can happen. Or the needle will come out of the skin, but when come out of the skin, will get inside. It's a small needle, sharp, will not be marked, bleeding, nothing. Will come out, and then will be inside, okay? Then you pass alcohol, it's okay. And the other thing, let's say that you are injecting, what can happen? Maximum that can happen, maximum you can touch a muscle. Maximum can happen, to happen once, you can touch the bone, let's say the arca superior spinale, the upper part, okay? What happens? You feel the needle that makes tick, tick, and finish. Nothing else, no pain, nothing. They don't even understand that thing, okay? And of course nothing happens because the moment that you do the motion, you are not injecting. So let's say you go, you touch, they make up, finished. So you get up and you inject, okay? So practically nothing happens. And you have just to check the needle, because the needle, when it's moving, when you are going like that, and the needle is straight, means that you are okay. If you are moving and the needle is like that, means that you have injected there and you have moved your hand from the other direction. So the needle must be always in the way that is like vector with your hands. You cannot inject here and have the hand, and then you must inject always like that. Then I give to doctors sometimes and they take the needle like that. No, the needle must be like, don't worry, I don't inject. The needle must be like, you must feel it only like that. There is no other way. And if it's difficult, you have to learn like that. Because if you inject in another way, you can have problems, okay? Because this gives you the sensation of the resistance, okay? That's all.